Hello, I'm Corey Rodas, and in this video, we hope to inform you a little bit more about spina bifida.
Spina bifida means split or divided spine and occurs within the first 6 months of pregnancy. It occurs when the spine, brain, and/or meninges fail to fully develop. It affects between 1,500 and 2,000 babies a year in the United States. It most commonly affects babies in Ireland and Wales, and least commonly in Israel among the Jewish peoples. There is no known cause for spina bifida, although it is thought that it is the result of genetic and environmental factors in the womb.
There are 4 types of spina bifida: oculata, neural tube defects, meningocele, and myelomeningocele.
Oculata is the most common and least severe form of spina bifida. It occurs when one or more vertebrae is malformed. Oculata means hidden, which tells us that this form of spina bifida is when the opening to the spine is covered. There are quite often few or no symptoms associated with oculata.
Closed neural tube defects are the second type of spina bifida. Closed neural tube defects are a very diverse group of spine defects. With NTD, the spinal cord is marked by a malformation of fat, bone, or membranes. Some patients with NTD experience few or no symptoms, while others experience very severe symptoms such as incomplete paralysis and urinary and bowel dysfunction.
The third type of spina bifida is meningocele. The meningocele is when the meninges, which are the protective covering around the brain and spine, protrude from the spinal opening. This malformation may or may not be covered by a layer of skin. The symptoms can be few or they can be severe in many. They are very similar to those of neural tube defects.
The fourth and final form of spina bifida is the most severe. It's also the hardest to spell: myelomeningocele. This occurs when the spinal cord is visible through the spinal opening. This exposure of the spinal cord causes paralysis of body parts below the spinal opening.
Spina bifida is caused by the failure of the neural tube to close completely, causing a malformation or an abnormality. Research also indicates that spina bifida could be caused by a lack of folic acid, a common B vitamin, in the mother's diet. Along with the lack of folic acid, it is thought that some genetic malformations already in the fetus could cause malformations that make the fetus susceptible to the malformations that cause spina bifida.
Spina bifida is often obvious at birth due to the malformation of the spinal column. Sometimes the spinal cord is completely exposed and can be seen as a mass of meningeal membranes on the back. Spina bifida can occur anywhere from the base of the skull to the lower back along the spine, though most cases occur on or near the lower back. Spina bifida can also appear as a lump on the lower back. Paralysis and other symptoms depend on where the malformation occurs. For example, if it occurs at the top of the spine, the paralysis could occur anywhere below that point. Spina bifida can also cause skeletal muscle paralysis. As stated before, spina bifida can also cause bowel dysfunction. Hydrocephaly, which is an excess amount of fluid in the 4 cavities of the brain, can also occur. 1 in every 7 cases develops Chiari-2 malformation, which is where the back of the brain is crowded and forced into the top of the spinal column.
Complications from spina bifida range from minor to severe physical disabilities to severe mental disabilities, although most sufferers of spina bifida are of normal intelligence. The severity of these complications depends on the size and location of the malformation, and also which nerve it's on and if it's covered by skin or not. In some cases, some patients with spina bifida also develop diabetes, skin allergies, gastrointestinal conditions, and depression.
Spina bifida is usually diagnosed prenatally, in other words, before birth. In some milder cases, spina bifida may go unnoticed altogether until after the baby is born. In extremely mild cases, spina bifida may go completely unnoticed altogether. During pregnancy, the most common test to screen for spina bifida is fetal ultrasound. However, it does not screen specifically for spina bifida and does not definitively prove that there is any neural tube defect at all. Spina bifida can be diagnosed postnatally with X-rays during routine checkups. More severe cases are usually visible at birth.
No cure for spina bifida. However, treatment options are available to those with spina bifida. Patients with mild cases often don't need treatment, but may need surgery as they grow. Patients with severe cases, however, it is the main objective to keep the infection out of the opening on the spine. Patients with severe cases often have surgery to close the opening on the spine and to protect the spinal nerves. Recently, experimental fetal surgeries have been conducted on fetuses with spina bifida. These surgeries are still new and experimental, however, and have risks that may affect both fetus and mother. These risks include premature birth, organ immaturity, brain hemorrhage, and death. Risks to the mother include blood loss, gestational diabetes, and weight gain. Children who develop hydrocephalus usually need more surgeries to replace the shunt, a hole that allows fluid from one part of the body to the other. Assistance devices may also be required, such as walkers, crutches, and wheelchairs, to patients with spina bifida.
Research is being done to find the basis of heredity for neural tube defects by the NINDS, or the National Institute of Neural Disorders and Stroke. Research is also being done to find the gene expression during the process of neural tube closure, which may provide insight to the human neural system during development.
Spina bifida is a terrible disease that affects thousands of people each year. For more information, visit www.ninds.nih.gov.
Now I don't even know what comes after that. It's just the myomeningeus. This occurs when the spinal cord is exposed to myelomeningosally. See, I can do it right now. Watch. The fourth and final form of spina bifida is the most severe. It's also the hardest to spell. Myelomeningosally. Myelomeningosally.
Are you ready?
For what?